Hi friends, this week's video is about how to stop breast milk. How to stop the mothers feeding breast milk. Hi friends, this is Dr. Karamat. This channel is Scientific Doctor. In this channel, I release videos every week on health and nutrition and medical related topics in very short, simple videos. If you want to see such videos, kindly subscribe to this channel. Also press the bell icon adjacent to it to get instant notifications whenever I release new content. This week's video is about how to stop mother's milk secretion or breast milk secretion. Mother's milk is the elixir of life. So it is essential that we provide mother's milk to all babies. All babies. Till 6 months of age, exclusive mother's feeding. From then on, mother's feeding plus complementary feeding. You can continue mother's milk up to 2 years or even beyond if the baby and the mother desires. So this is very simple. So whom this video is for? For those mothers who for some reason want to stop breastfeeding. We have to differentiate this scenario based on the age of the child, because this will mark the stage of mother's feeding also. If the child is less than 6 months old, the mother will be secreting more milk. Okay. So it is difficult to stop breastfeeding at this age. 6 months to 12 months, if the baby has started on complementary feeding, this is little easier. If like in subcontinent, you have continued breastfeeding for 1.5 years, 2 years, the baby is on full feeds and you are giving 1 or 2 feeds, at that stage to stop breastfeeding is much easier. In the first scenario, when the baby is less than 6 months, my advice would be to continue mother's feeding, whatever be the reasons you are going through. But for some unfortunate individuals, if you can't help, so you have to stop mother's feeding, you have to arrange for baby's substitute feeding. At this stage, you can't initiate food, it is dependent on milk. Less than 1 year of age, it is not advisable to start on unmodified animal milk. This is the recommendation of WHO, World Health Organization. So, what does that mean? You can't just give cow's milk or buffalo milk or almond milk, the packet milk directly. You have to give a formula milk that is modified for infants' needs. But if you can't afford formula, you can choose to give cow's milk or packet milk, but this is the least preferred option. So the first idea is to ensure the baby is feeding, because the baby is dependent completely on mother. So you are going to stop mother's feeding, means you have to arrange for substitute feeding. Okay, you have arranged. How to go about stopping feeding in the mother? So if you have time, do it slowly over a period of few weeks, 2 to 3 weeks. This is much easier. Every 2 to 3 days, drop one feeding. Okay, drop one feed at a time. At that time, initiate substitute feeding. It is much easier for the baby as well as the mother. But for some reason, if there is no time, you want to go cold turkey, immediately stop feeding. You can do that, but the chance of milk engorgement in the breast of the mother is more. It may get extremely painful. How to prevent this? No, you can apply hot compresses before giving feeding. You can even place cold cabbage leaves over the breast, under your inner garments, bra. So you can do that. So this is supposed to help. At least the few studies have demonstrated definite help by placing cold cabbage leaf. Cold meaning you can place the cabbage leaves in the refrigerator and take them and place them over your breast. So that is supposed to help. You can take simple painkiller medicines like Brufen or paracetamol. You can let out milk. But remember, if you let out milk completely, like the baby does when the baby is feeding, that is the strongest stimulus for continued feeding. So you will have even more secretion of milk. So you have to let out only a little milk just to reduce the weight of the breast, just to reduce the pain, not completely empty the breast. So then you will have even more secretion. You can let out a little just to reduce the pain. So all these measures can be done, but if there is high grade fever or if there is discharge from the nipple, you have to visit the doctor. If the child is little older, between 6 to 12 months of age, you have initiated complementary feeding and you want to stop breastfeeding because the mother wants to go to work or some other reason. You can continue again breastfeeding. You can continue night feeding. Only during the work hours, you can express the milk and give it to the baby. But for some reason, you need to stop completely. Then you can do the same things like dropping one feed at a time, or if it is not possible, completely go cold turkey, but do the measures to the mother so as to reduce the secretions. But increase one food frequency. Like for an 8-month-old child, for a breastfeeding child, you are giving 2 or 3 times complementary feeding. If you want to stop breastfeeding, you need to increase the complementary food by 1. That is, you need to give 4 feeds of complementary feeding, and you can substitute, as I said, alternate milk in the form of formula milk, or very rarely, not so desirably, cow's milk or buffalo milk. Okay. In the third scenario, 1.5 years, 2 years, the child is completely on food and other milk. The child is not dependent. Just for a little nourishment, the baby is continuing to feed. You want to stop. There is no need to go slow here. You can just stop. The risk of engorgement is very less for the mother. So you can just blindly just stop the feeding. There should be no issues. Remember, the strongest stimulus for breast milk production is the love for the baby, is the touch of the baby sucking at the breast. So if the baby is not doing all these things, the secretion will cease. So I give a simple tip for this scenario alone. When the child is 2 years old, you can physically be separated from the child, because the child is not going to cry, not going to create a fuss. You are not going to see the child. The child's plight of crying and fussing and child's touch. So all that will reduce the secretion so that there is no engorgement, and you can easily stop, cessate breastfeeding very easily. So this is only for the third scenario. Remember, at all times when you stop breastfeeding, think about the nutrition of the baby, ensure correct nutrition of the baby, and finally you can go on to stop the breastfeeding. What about medicines or drugs? As I initially said, you can use simple painkillers called NSAIDs or Brufen or paracetamol. But if you want to take medicines to stop breastfeeding, these are hormonal pills. You can either use your birth control pills or specific hormonal pills as prescribed by your doctor. These are not routinely recommended. Only if the child is very young, somehow for mother's sake, you need to stop breastfeeding, and there is heavy engorgement, the mother is probably having fever. At that scenario alone, probably with the prescription of your doctor, you can take these hormonal tablets. During all other times, it is easier by adopting the above said measures. If this video was found useful to you, kindly share it among your friends and relatives. To see such videos, kindly subscribe to this channel. Till we meet again, bye.